Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
When you think about babies, toddlers, it really feels like they spend, half their lives asleep?
Oh, absolutely.
I saw this stat up to 18 hours a day for kids under 4. That is just a huge chunk of their day.
It really is a critical chunk, too.
Exactly. But here's something a bit, unsettling. What if that cozy little mattress where they spend all that time isn't quite as harmless as we think? We've been looking into some pretty fascinating science, maybe a little alarming too, that suggests there could be hidden chemicals lurking in there.
That's a really vital point. We focus so much on baby proofing, sharp corners, outlet covers, cabinet locks.
Right, all the obvious stuff.
Exactly. But we might be overlooking what's literally right underneath them while they're sleeping. There's some recent work out of the University of Toronto, published in Environmental Science and Technology, and also Environmental Science and Technology letters. They've really been digging into what's inside children's mattresses.
And wasn't there an in-home study too, to see what's actually happening in bedrooms?
Yes, also in Environmental Science and Technology letters. That one gives us a more real-world picture.
Okay, so for this deep dive, our plan is basically to unpack all this. We want to pull out the key stuff from these studies. Figure out what the potential risks might be, but, without getting lost in all the heavy science talk.
Yeah, make it understandable.
Right. The mission is just to get the crucial info out there, especially for parents, or really anyone looking out for kids' health, so you can understand what's going on and maybe make some informed choices.
Sounds good.
So let's start with these studies. What were the researchers actually trying to figure out?
Well, there were kind of two main angles they took. The first one involved looking at the actual air inside kids' bedrooms.
Okay, in real homes.
Yes, exactly. They went to 25 homes in Toronto and Ottawa, focusing on children between 6 months and 4 years old. And they measured the air for specific types of chemicals.
Like what?
They were looking for phthalates. Those are the chemicals often used to make plastics softer, more flexible.
Right, I've heard of those.
And also flame retardants. And ultraviolet filters the sort of things you might find in dyes, or to prevent materials from degrading in sunlight.
And what did they find just looking at the air?
What was really interesting and kind of the starting point for the next phase was that the highest concentrations of these chemicals were found in the air right near the children's beds.
Ah, okay, so closer to the mattress.
Exactly. That immediately made them think, okay, maybe the mattress itself is a major source here.
That makes total sense. If it's highest right by the bed, look at the bed. So the second part was testing the mattresses directly.
Precisely. For that part, they got 16 brand new children's mattresses. They bought them in Canada.
Okay, just Canadian mattresses then.
Not in Canada, but it's important to remember that the materials often come from all over the U.S., Mexico, other places.
Ah, right. Global supply chains.
Exactly. So what they found is likely relevant across North America, probably wider. And they weren't just checking if the chemicals were there. They also wanted to see how a child actually sleeping on the mattress might change things.
Okay, how on earth do you test that in a lab? Simulate a sleeping child. Sounds complicated.
It's pretty clever, actually. They use these special little devices, passive samplers, made of a silicone material. They put them on the mattresses for 72 hours to basically soak up any chemicals being released.
Okay.
But here's the really insightful bit. They tested under different conditions. First, just at room temperature. Then they heated a section of the mattress to body temperature, about 37.5 degrees Celsius.
Like a warm little body lying there.
Exactly. They also added a weight, 7.5 kilos, to simulate the pressure of a small child. And then they did the most realistic test, combining both the body heat and the weight.
Got it. Covering all the bases.
Yeah. And they didn't just test the whole mattress. They also analyzed the foam inside and the fabric covers separately.
Wow, okay. That is thorough. So after all that meticulous testing, what did they actually find inside these brand new kids' mattresses?
Well, they found quite a cocktail, actually. Lots of these things. It's semi-volatile organic compounds, SVOCs.
Semi-volatile, meaning they release slowly over time.
Exactly. They don't evaporate instantly, but they do steadily come out of the material into the air. Out of 45 specific chemicals they were targeting, they found 21 of them across those 16 mattresses.
21?
Yeah. This included various orthophthalates, those plasticizers, again, several types of organophosphate ester flame retardants, and also benzophenones and salicylates, which are those UV filters we talked about.
21 out of 45, that's nearly half the list they were looking for. It just shows how complex these materials are. Were any of those results particularly worrying?
Definitely. For starters, one mattress had levels of a specific phthalate, dimethyl phthalate. They were actually above the legal limit set by Canadian regulations for mattresses.
Above the legal limit in a new mattress.
Yes. And maybe even more striking, 5 different mattresses had levels of 3 other phthalates, diacylbutylphthalate, dianoctylphthalate, and the isonylphthalate that exceeded the limit that Canada has for children's toys.
Wait, so level's okay for a mattress, but not okay for a toy? That seems odd, doesn't it?
It really does highlight a potential gap in the regulations. You'd think something a child sleeps on for hours, night after night, would have standards at least as strict as a toy they might mouth occasionally.
Yeah, absolutely. Any other red flags?
There was another big one. One mattress contained a really high level of something called trichloroethyl phosphate, or TCEP,
Oh, okay. What is that?
the flame retardant. And the key thing here is that it's been banned in Canada for use in polyurethane foam in children's products, like mattresses, since 2014.
Banned since 2014, but they found it in a new mattress.
Yes, which is obviously a major concern. It points to a potential breakdown in manufacturing oversight or supply chain control. Someone somewhere isn't checking properly.
That's more than just a little worrying. That sounds like a system failure. How does that even happen?
It raises serious questions. And it wasn't just that one banned chemical. They also found that many of the mattresses contained other types of flame retardants, organophosphate esters, sometimes making up like 1 to 3% of the mattress by weight.
1 to 3%? That sounds like quite a lot.
It is. And here's the kicker. These particular flame retardants aren't actually needed for mattresses to meet the current fire safety standards in either Canada or the U.S.
Hold on. So they're putting these chemicals in, chemicals with known health concerns we'll get to, but they don't even need them for fire safety.
Apparently not for these specific types, according to the researchers.
Why would they do that then? Is it cheaper? Just old habits?
That's a really good question. It could be inertia in manufacturing, maybe cost, maybe lack of awareness about alternatives. But the researchers really emphasize that these seem to be unnecessary chemical additions, adding risk without a required benefit.
Unbelievable. Okay, so phthalates, banned flame retardants, unnecessary flame retardants, anything else?
Yes, they also found those UV filters, benzophenones, and salicylates, mostly in the fabric covers of the mattresses.
So just a whole mix of stuff in there. And what about the heat and weight simulation? You said that was insightful. How did that change things?
This is really key, I think, especially for parents. When they simulated the child's body heat and weight, the amount of chemicals coming off the mattress increased significantly.
Increased by how much?
In some cases, several times higher than at room temperature. And not only did the amount increase, but they also detected a wider variety of chemicals being released under those conditions.
Wow. So the very act of the child sleeping on it, being warm and putting pressure on it, actually makes the exposure worse.
That's what the findings strongly suggest. It's like the warmth and pressure help mobilize these chemicals out of the foam and fabric.
That is definitely not something you want to picture.
No, it isn't. And one other finding that was quite interesting. They tested duplicate mattresses, same brand, same model, bought from the same place, but about 2 years apart.
Okay.
And they found their chemical compositions were noticeably different.
Huh. So you can't even rely on consistency within the same product line over time.
It seems not, based on this limited comparison. It suggests manufacturing processes or material sources might change, leading to different chemical profiles even in what looks like the identical product.
That really makes it hard for consumers, doesn't it? Needing constant vigilance. Now, what about that in-home study? Did it back up these lab findings?
It did, and it added some important nuances. Remember, they looked at the air right around the sleeping child, the microenvironment.
Right.
They found that the concentrations of most of these semi-volatile organic compounds were higher in that immediate sleeping zone compared to the general bedroom air.
Okay, so definitely confirming a source close by.
Yes. And they were able to link the mattresses as a likely source for many of the phthalates, all the ones they measured, except for one called diethyl phthalate, and also for several of the organophosphate ester flame retardants. Again, with one exception. A chemical called TBOEP, tris-2-butoxyethyl phosphate.
So TBOEP wasn't coming mainly from the mattress.
It seems not entirely. They found higher levels of that particular one in the sleeping zone than seemed to be coming off the mattresses in the lab tests. This suggested that other things in the bed, like maybe the sheets, blankets, pillows, could be important sources for TBOEP specifically.
Ah, okay. So it's the whole sleep system, potentially, not just the mattress itself. Did the age of the mattress matter in the home study?
It did seem to. They observed that older mattresses tended to have higher concentrations of two specific phthalates, DEHP, which is di-2-ethylhexyl phthalate, and BZBP, benzoyl butyl phthalate.
Why would older ones have more? Wouldn't they have aired out?
You might think so, but it could be that the materials degrade over time, releasing chemicals more readily. Or it could be that those specific phthalates were used more commonly years ago before some regulations tightened up, so they're just more present in older products.
Okay, that makes sense. So we've got a clear picture now. These chemicals are in the mattresses. They do come out, especially when a child is sleeping, and they're measurable in the child's immediate sleeping area. Let's get to the core concern. What does this mean for health?
This is really the heart of the issue. Many of the chemicals detected, particularly the phthalates and the organophosphate ester flame retardants, are known endocrine disruptors.
Endocrine disruptors, meaning they mess with hormones.
Exactly. Hormones are like the body's chemical messengers, controlling so much development and function. Interfering with them is especially risky during the critical windows of development in early childhood.
Right.
These same groups of chemicals have also been linked in numerous studies to neurological problems. Things like learning disorders, lower IQ scores, behavioral issues like ADHD symptoms, problems with memory.
That's incredibly serious.
It is. And there are also documented links to increased risk of childhood asthma and even some concerns about links to certain cancers down the line.
Wow. What about the UV filters?
Some of those, the benzophenones and salicylates, are also suspected of being hormone disruptors, although perhaps the evidence is still developing compared to phthalates and flame retardants.
And why are babies and young kids considered uniquely vulnerable here? It's not the same exposure risk as for an adult, right?
No, definitely not. There are several reasons. First, their bodies and brains are developing so rapidly, making them inherently more sensitive to disruption.
Okay.
They also have different behaviors. Think about hand-to-mouth activity. Babies and toddlers put everything in their mouths. This means they can ingest dust that contains these chemicals shed from the mattress.
Right. I didn't even think of the dust.
And they breathe more air relative to their body size than adults do, so they inhale proportionally more of any airborne chemicals.
Makes sense.
Plus, their skin is thinner and more permeable, and they have a larger skin surface area compared to their overall body weight. This means potentially greater absorption through the skin as well.
So multiple pathways, breathing, ingesting dust, skin contact, and their developing systems are just more susceptible.
Precisely. They're taking in more, and their bodies are less equipped to handle it, potentially, and the impact on development can be greater.
And layering onto that, the fact that sleep itself is so crucial for brain development.
Absolutely crucial,
Wow.
especially in those first few years. So the idea that the very environment where this critical brain development is happening during sleep might be a source of exposure to neurotoxic chemicals. Well, that's the central concern raised by this research.
Yeah, it's definitely a wake-up call, as one of the researchers apparently put it. Now, we should be fair. Were there any limitations to these studies we need to keep in mind?
Yes, definitely. It's always important. The main one for the lab testing was the sample size 16 new mattresses.
That doesn't sound like a huge number.
It's not massive, no. It provides really valuable data. But you'd ideally want to see tests on a much larger and more diverse range of mattresses to know how widespread these issues are.
Okay. Anything else?
Just to reiterate that point about geography, while bought in Canada, the materials are global. So the findings are likely relevant elsewhere, particularly the US, due to market integration. But specific chemical profiles might vary slightly based on different countries' regulations or common manufacturing practices.
Right. So indicative, but maybe not universally identical everywhere. Good points. What did the experts who actually did this research or others in the field say about the implications?
They were quite clear about their concerns. Professor Miriam Diamond at the University of Toronto, who was a senior author, really emphasized the potential harm to developing brains. She explicitly called for manufacturers and policymakers to step up and make sure kids' beds are safe places that support healthy development, not hinder it. She used that phrase, wake-up call.
Strong words. Were there other expert takes?
Yes. Arlene Blum from the Green Science Policy Institute, she was also an author, she specifically highlighted how unnecessary many of these flame retardants seem to be for meeting fire codes.
Right, the point we discussed earlier.
Exactly. She pointed out the long history linking these kinds of chemicals to cognitive and learning problems in children, and basically asked, why are we still using them so widely if they aren't even needed for safety?
It's a very valid question. So the experts are clearly calling for change. What kind of actions are they recommending?
Broadly, they're pushing for mattress companies to be way more vigilant. They need to be testing their products regularly and thoroughly for harmful chemicals, both ones that are banned and ones that are simply unnecessary.
So more industry responsibility.
Yes. And alongside that, a call for stronger government regulations, specifically targeting harmful chemicals like these flame retardants and phthalates in products children sleep on.
Like extending the toy regulations you mentioned.
That's one specific suggestion, yes. Applying those stricter limits for certain phthalates found in toys to mattresses and bedding too. They also specifically mentioned the need to finally implement proposed Canadian restrictions on two specific flame retardants, TCPP and TDCIPP, which have been debated for a long time.
So closing regulatory gaps.
Exactly. And given they found banned substances, it also points to a need for better enforcement and oversight all around. The overall message is manufacturers need to be more responsible and transparent about what's actually in these products.
It definitely sounds like a multi-pronged approach is needed. Industry action, government action. But in the meantime, what can parents listening right now actually do? Are there practical steps based on this research?
Yes, the researchers did offer some tangible advice. One key thing is to try and simplify the child's sleep space.
How so?
Basically, declutter the crib or bed. Fewer extra pillows, fewer blankets, fewer stuffed toys in the immediate sleep area means fewer potential sources for these chemicals and less surface area for dust to collect, which can carry these compounds.
Okay, keep it simple. Makes sense.
Another recommendation is frequent washing of bedding and any sleep clothing the child wears. The idea is that washing can help remove some of the chemicals that might transfer onto the fabrics, acting kind of like a barrier that gets regularly cleaned.
Wash often. Good tip.
And one more suggestion was to consider using undyed or neutral-colored fabrics for bedding and sleepwear.
Why undyed?
Because vibrant dyes sometimes contain additives, including those UV filters like benzophenones, which were found in the mattress covers. So choosing plainer undyed options might reduce exposure to those specific additives.
Interesting. So declutter, wash frequently, maybe choose undyed fabrics. Those are concrete things people can do. And just to loop back on the bigger picture, the systemic changes.
Right. Beyond individual actions, the researchers are really hammering home the need for those stricter regulations on mattresses, potentially aligning them with toy standards for certain chemicals. They specifically question if the current 0.1% limit for some phthalates is adequate for something with such prolonged close contact.
Yeah, that seems low for something you sleep on for hours.
And pushing for action on those proposed flame retardant bans, TCPP and TDCIPP. Plus, that strong call for manufacturers to step up. Test your materials. Know your supply chain. Stop using banned chemicals. Phase out unnecessary ones and be more open about what you're using.
It really is a call for change at multiple levels, isn't it? From our own homes right up to industry practices and government rules. Definitely leaves you with a lot to think about.
It absolutely does. And maybe it encourages us all to think a bit more critically about the unseen chemical environment in our homes, especially in these really intimate spaces where kids spend so many vulnerable hours. It kind of prompts you to question what's in everyday products and maybe look for safer options or even push for better standards overall.
Thanks for tuning in to the Health Headliner podcast by To-Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.